How is diverticulitis abscess drainage performed? When a pocket of infection forms in the colon due to diverticulitis, doctors may need to drain it to help the infection clear up and prevent serious complications. This process is called abscess drainage and is usually done when the abscess is larger than 3 or 4 centimeters, or if antibiotics alone aren't enough. The goal is to remove the infected fluid, reduce the risk of the infection spreading, and help the body heal. Most often, doctors use a minimally invasive method called percutaneous drainage. This involves inserting a thin needle through the skin, guided by imaging scans like ultrasound or computed tomography. The doctor carefully guides the needle into the abscess, confirms placement by aspirating some pus, and then leaves a small flexible tube called a drainage catheter in place. This catheter allows the pus to drain out over several days. The procedure is generally safe, effective, and can often help patients avoid open surgery, leading to shorter hospital stays. In some cases, especially if the abscess is deep in the pelvis and hard to reach from outside the body, drainage might be performed through the rectum or vagina. This approach is also guided by imaging to ensure accurate placement of the drainage tube. It's a less common method but useful for certain abscess locations. If less invasive methods aren't possible or don't work, surgery may be necessary. Surgical drainage involves opening the abdomen to directly access and drain the abscess. This is more invasive and usually reserved for complicated cases, such as when the abscess has multiple compartments or is not responding to other treatments. The process begins with confirming the abscess's location and size using imaging scans. The medical team, including a radiologist and surgeon, then plans the best approach. Before the procedure, the patient receives antibiotics to fight the infection, and local anesthesia is used to numb the area. During the drainage, the doctor inserts the needle under imaging guidance, aspirates pus to confirm correct placement, and then inserts the drainage catheter. The catheter stays in place for several days until the abscess is fully drained and the infection is under control. After the procedure, the catheter is monitored closely, and the output is measured. Antibiotics continue to be given, and the patient is watched for signs of improvement or any complications. Once the infection resolves, doctors may recommend further treatment, such as surgery to remove the affected part of the colon, especially if the patient has had repeated episodes of diverticulitis. It's important to remember that not all abscesses need drainage. Small abscesses often respond well to antibiotics alone, but larger or symptomatic abscesses usually requiring drainage to speed recovery and prevent further issues. The benefits of percutaneous drainage include being less invasive, having a lower risk of complications, and potentially allowing for later surgery if needed. However, risks such as bleeding, injury to nearby organs, or incomplete drainage can occur, and about a quarter of patients may need surgery if drainage isn't successful. Following drainage, patients are typically evaluated for elective surgery to remove the diseased part of the colon, especially if they have had severe or recurrent diverticulitis. But in some cases, especially for older or medically fragile patients, surgery might not be recommended. Always consult with healthcare professionals to determine the best approach for your specific situation. Remember, drainage is a well-established, safe, and effective treatment option for managing abscesses caused by diverticulitis, helping many patients recover without the need for immediate surgery.